Good morning, everybody, and welcome. I'm Chris Perrone, Director of Improving Access to Care at the California Healthcare Foundation, and I'm delighted to be kicking off the 2020 annual meeting of the eConsult Workgroup. I can hardly believe it's been 15 years since colleagues and I first met Hal Yee to discuss his e-referral pilot at San Francisco General and the astounding results they were having in reducing waiting times for patients at the GI clinic, while strengthening the capacity of primary care and also reducing the burden on both patients and providers of visits that were ineffective. At the California Healthcare Foundation, where our mission is to advance meaningful and measurable improvements in the way the healthcare delivery system provides care to the people of California, particularly those with low incomes, Hal's pilot was an exciting breakthrough. I lead our work on improving access to care for Medi-Cal enrollees who are 2 times as likely to report difficulty finding a specialist as other insured Californians and often wait for months to get the care they need. The opportunity to reduce waiting times for Medi-Cal enrollees for needed specialty care by up to 90% while making more effective use of scarce resources grabbed our attention as it has yours. It's astounding how much what we now call eConsult has grown since then, and certainly the range of speakers and the participants at today's meeting are evidence of this success. Frankly, it's also a bit disappointing that 15 years later, we still have far to go. I am truly buoyed by the passion, energy, and efforts that all of you are investing to spread adoption throughout the safety net. The California Healthcare Foundation is proud to support the eConsult Workgroup, which has been a tremendous platform for those of you on the front lines of innovation to discuss your challenges, to share your successes and hard-won victories, to collaborate and to problem solve. This annual meeting is usually the one time of the year when we meet in person to continue this work and to plan goals for the year ahead. And while we're all disappointed not to be gathering in person today, the upside is that we're able to open the meeting up to more participants, and without the demands of travel, we have what is surely the strongest group of speakers from California and around the country we've ever seen. I am excited to hear from all of you who will be sharing your ideas and experiences, discussing how we address the challenges before us and set our future vision. And I am particularly delighted that we have Dr. Wando Alewala as our keynote speaker. I know several of you have worked with Wando and know that she, like many of you, brings great passion to the care of her patients, a systems approach to problem solving, and the energy of an innovator. She may not be a Californian any longer, but Wando, if you've joined us, you'll always have a home here. And maybe like Michael Drake, UC president and former CHF board member, who also found his way to the Ohio State University, you'll even return. My congratulations to Timmy, Libby, and the entire Blue Path team, and everyone else who has had a hand in organizing today's meeting. Last, from one funder to others, I want to thank the sponsors of today's annual meeting: Anthem Blue Cross, ConferMed, Inland Empire Health Plan, Safety Net Connect, Wise Healthcare, Arista MD, and Rubicon MD. I also want to encourage more of you to support the work of the eConsult Workgroup. If you find today's annual meeting valuable or you regularly attend the monthly virtual meetings, I encourage you to reach out to Libby and Timmy to sponsor the workgroup or the 2021 annual meeting. Any support you can provide will help further the work and goals of this work group. Thank you, and with great enthusiasm, I hand off the baton to Libby Segarra, Blue Path Health.
Thank you so much, Chris, and we appreciate your call out to our wonderful sponsors, and I do want to note that our work could not be done without the support of California Healthcare Foundation, so thank you for kicking us off. This is going to be a great 2-day event. We, as the eConsult Workgroup, are happy to kick it off. You all have access to our materials, our agenda at econsulttoolkit.com, just in case you need to refer back to those materials. And just a high-level agenda review here, we have a great list of participants and speakers today, as Chris mentioned, moving from a payer panel made up of our wonderful supporter, Greg Buchert, who is one of our clinical advisors, Bill Barcelona, Abby Totten, and Joel Gray, moving on to our keynote from Dr. Wando, a great provider panel kicked off with our additional advisors, Drs. Tuo and Gibney. Moving on to a great discussion of eConsult Frontiers, where we're moving next, headlined by Dr. Michael Barnett. And in the afternoon, we'll take a quick break to dig into reimbursement and some of the challenges we all experience around capturing eConsult over our lunch break, and then bringing back to one of our very most important themes of this year, equity in eConsult and telehealth, digging into some of our remaining challenges around legal and compliance situation or considerations, and measuring improvements in access, and landing on just a recap of our priorities for the coming year. So as Chris mentioned, we're so excited to see so many new faces on today's meeting, and we hope to see you on our monthly meetings to tackle these issues in the coming year. We did our call out to our sponsors, but we're glad to see your faces on today, and thank those sponsors for kicking off our session with fireside chats that so many of you are able to join. We have people popping in because those conversations were going so well. Some of them went a little bit long, so thank you so much for joining back into our main webinar session. As Chris mentioned, we've been around for a few years now. This is, I think, our 6th meeting of our eConsult Workgroup. For those of you who are new, I don't know if I mentioned, I'm Libby Segarra. I facilitate our monthly meetings. I'm with Blue Path Health. And we've known each other for so long now, and we're so glad to see our group expand from a fairly California-focused group to across the country. We are so glad to have such active participants from Colorado, Connecticut, DC, Arkansas, New York, Massachusetts. It's growing and growing. We started out 5 or 6 years ago tackling what is eConsult, trying to define it, trying to figure out how we capture this in a way that both policymakers, patients, and providers could agree and understand. We were happy to see both CMS and state policymakers agree that eConsult is an encounterable service, and we now have CPT codes across the country to be able to capture these services. We dig in on our monthly calls into some of the issues and questions around eConsult, some of the legal issues like consent and the definitions around overall telehealth. And then we also work to engage both payers and providers to make this something that's sustainable. This year, we've seen so much progress, and I guess it's a double-edged sword. We've been burdened with so many crises, and that's the theme of our this year, our 2-day event this year. But with the crisis of the pandemic, we have had obviously a call to action in adopting telehealth and eConsult. So many of our vendors that are supporters of our work group have offered free options, free opportunities for providers to engage in eConsult to better support their patients during this crisis. And we've seen payers stand up to support these efforts, to collaborate, to work together so that providers have more consistent and simple ways to adopt eConsult. And we're seeing more consistent reporting of eConsult. We're seeing states embrace it to understand better what it means. We're gathering all today, and we'll look at our remaining work in the next year and perhaps take your feedback today and look at what we're doing in 2021 and revise it a bit. But in 2021, we're looking to continue with these collaborative models between primary care providers and payers. We're looking to our state Medicaid agencies to be able to better reflect and adopt eConsults in their rates. And we're looking to acknowledge that eConsult does expand access. We've all learned that over the years, and we want to be able to show that to our policymakers. We, as working with our very loyal participating managed care plans, we want to be able to have that consistency of reporting to be able to better engage providers. And one of our last issues to tackle is how do we see eConsult expand in Medicare? So we'll be touching upon that a bit today. So with that, I want to take a quick moment to acknowledge our great supporters and advisors who've been active with us over the past few years. Dr. Delphine Tuo, Dr. Greg Buchert, and Dr. Paul Gibney, who are on with us today. These are our initial group of eConsult Workgroup clinical advisors. These are our go-to people, those who are always available when we have questions around provider adoption, metrics, reimbursement. We really appreciate all that they've done with us, for us over the past few years. Dr. Tuo has been an active voice in our work group from its inception, supporting many of our public hospitals and clinics in standing up eConsult in California, and is an invaluable source of published data on our program at Zuckerberg SF General Hospital. Dr. Gibney of Los Angeles Department of Health Services. I think we can say at this point, Dr. Gibney has the largest eConsult program in the US, having done far more than 1 million eConsults at this point. He's also been an advisor to our California State Prime program, incorporating eConsult metrics into public hospital reporting. And Dr. Greg Buchert has broken ground in building his multiple organizations that he's led, payer telehealth programs from the ground up. And he's been a key advocate in our planned support of eConsult programs for their providers and being able to extend this service to their members. So we wanted to take a moment and introduce our advisors who will be speaking up throughout the day. They will be available to our work group, and we'll be announcing a new program where we'll have office hours to be able to make them available to you as members of our work group.